Well, you are paying billions of dollars for a national epidemic that's also costing us right here in Wisconsin.
Almost 40% of Wisconsinites are obese. New at 10, Casey Geraldo joins us now.
Casey, you found out we're all paying for this, huh?
That's right, George. We're talking billions of dollars in health care costs for everyone. That doesn't include other unexpected costs of obesity. The experts I talked to say it also won't be an easy fix.
Amy Barr was sick.
I developed high blood pressure. I developed high cholesterol. I developed diabetes. I developed sleep apnea.
She was missing out.
I couldn't do things on vacation. I couldn't, keep up with family.
At her heaviest, Barr weighed about 305 pounds. A 5'4" woman weighing 174 pounds or more and a 5'9" man at 203 pounds or more are considered obese.
The biggest cost to me in my life were opportunity costs.
And financially, Barr says she met her insurance deductible quickly each year. She had private insurance, but Dr. Patrick Remington says for uninsured people, Medicare and Medicaid, funded by your tax dollars, cover the cost too.
Between $2 and $3 billion are lost each year because of health care costs and indirect costs.
CDC numbers show 36% of Wisconsinites self-report obesity. That's data taken by phone, where researchers say people usually portray themselves as taller and thinner. In-person evaluations put the real percentage of obese Wisconsinites closer to 40%. If you're just overweight, your risk of dangerous conditions increases only slightly. The biggest risk is gaining more weight and becoming obese.
It's probably the #1 cause of preventable death.
The costs add up quickly in the doctor's office.
Obesity accounts for more than half of diabetes, more than half of hypertension in this state, but also about 1/3 of anxiety and depression.
Facing the severity of her health, Barr became one of few people who qualify for help from a bariatric surgeon.
A lot of people have the misconception that it's sort of the easy way out.
It takes 6 months for doctors to approve someone for surgery. In that time, patients learn how to live with their new digestive system.
It's a tough decision.
Dr. John Gould at Frederick Medical College of Wisconsin says bariatric surgery can help people when their obesity prevents a healthy lifestyle.
We can help them get healthier. We can help them to become more active.
The doctors agree surgery can end the conditions racking up the greatest cost for a small percentage of obese people.
For a diabetic patient, you'll recoup that cost in probably 2 to 3 years, and then you'll save money after that caring for them.
Since surgery, Amy Barr has broken her cycle of failed diet and exercise, running more than 50 races. Her conditions went away, and she was able to help her mom check Peru off her bucket list.
And I'm in the Andes walking up big hills and, not wanting to die.
She hopes to spread the healthier lifestyle she's learned.
Part of it is figuring out how do you influence and how do you bring other people into, a healthier lifestyle.
Weight loss surgery doesn't work for everyone, and only 5 to 7% of people who are obese qualify for that surgery.
Quite the transformation, though, Casey. What if someone is not a good candidate, as you mentioned, for this surgery?
There are a lot of options. The first place to start is with your doctor, and whether or not you're heavy enough to have something else going on, the doctors still try to work with those people with other available methods. Beyond diet and exercise plans, there are medications available, prescriptions that they can write now. So there are a lot of other things that they do to try to help people along their way. And of course, the first place to start is at the doctor's office.
Yeah, that makes sense. Okay, thank you very much, Casey.